Hello everybody, this is Dr. Kevin Connors with Section 6 of the Meeting Chronic Lyme book. Last section we started on different neurological issues that you can have with Lyme disease. So this section, you're going to learn about what actually happens with that neurological damage. So remember we said there's different type of glial cells. All of your brain cells, you have neurons and you have glial cells. The glial cells are separated into different types of glial cells. One of the types of glial cells, the astrocytes, surround the blood vessels, parts of them do, and create a barrier between the blood and the brain to keep things from getting in the brain that shouldn't be getting into the brain, like Lyme disease. So if there's a breakdown in that astrocyte blood-brain barrier, then bad things get into the brain, like Lyme disease, and we have a pickle on our hand. The microglial cells are really responsible for your immune response in the brain. And when you have activated microglial cells, like you would in Lyme disease, it could cause all sorts of problems with inflammation. You get brain inflammation. But also, you can have direct damage from the Lyme disease and indirect damage from the Lyme disease to the really maybe important, though I would never say that glial cells aren't important, cell of the brain, that is the neuron. So the neurons are what carry information from one part of it to another and then communicate to the next neuron, and it brings information. So if I want to raise my hand, I am firing neurons in the opposite brain, frontal lobe, premotor cortex to the motor cortex to down. It's complicated. So those neurons are firing in order for me to fire a muscle in order to raise my hand. So the neurons also have a glial connection because there's another type of glial cell on the neuron that form the myelin sheath. Those are called the oligodendrocytes. So the oligodendrocytes form a myelin sheath. And the purpose of the myelin sheath, you could think of it as like an insulation around a neuron so that communication, that neurological electrical firing could go much faster. So the reason why I can quickly move my hand when I want to move my hand is because I have myelinated nerves. So that nerve myelination is so important. So when I get demyelination, then my nerves don't work correctly. So there are certain diseases that cause demyelination. The most notable is MS and ALS. So really the real only difference between those two diseases is where the nerves are being demyelinated, which nerves are being demyelinated. But if you have rapid demyelination, you have rapid disease process going on, and you have rapid loss of function. So you can have a direct attack on the myelin sheath by a bacteria, like Lyme disease. Typically, you don't have a direct attack. You move into the autoimmune stage. So this is even worse. You have created antibodies to your own oligodendrocytes, your own myelin sheath. And now every time you fire an immune response, your Th1 and your Th17 cells are basically destroying your myelin sheath. So we're going to go into how you treat this, and sometimes even more importantly, what you do not do if you have an autoimmune Lyme or any autoimmune disease, because you don't want to add to the destruction of your myelin sheath. So very important there. So top right here shows a myelin sheath that's being destroyed, and you start to get these neurological disorders. Like in this person's face, they have a facial paralysis. This is of the cranial nerve 7. Person sticking their tongue out, they have a paralysis of cranial nerve 12. You see difference in their brain scan on the left-hand side. This is the ALS patient, where there's just overall degeneration in neural tissue. This is where it becomes very serious in you. And all Lyme disease has the ability to progress to this point, and you do not want it to progress to this point, so you better know what you're doing in treating it. You cannot treat an autoimmune Lyme disease the same way you treat a chronic Lyme disease. Scream that from the rooftop. You'll learn what we're talking about as we go in here. Again, this is a picture of the last slide that I had at the last little talk, it talks about the different symptoms. Go through the book on the symptoms and check what you have. It's important because it can really give you an idea um, where you're at. Understand, I did this whole program because one of the biggest things that I got when I lectured to Lyme patients is that they're broke. They've used up every cent that they have trying to treat it for the last 6, 8, 12, 14 years. They don't know what else to do. So I'm trying to give you as much information as possible. So um, uh, I just can't treat people for free. I just can't do that. We're too busy. So I'm trying to give you as much information as possible that you can treat it. If you have a lot of these symptoms, I've given you a lot of ideas. If you have some of these symptoms, you are probably autoimmune and you have to treat it that way. So stay tuned. We're going to continue to dig into this. I hope you're getting a lot out of this. If it's new to you, listen to it again. If you got Lyme brain, listen to it about 50 times. I understand. I've had Lyme twice too, and I have a lot of Lyme patients. So we'll see you at the next section.